Cardiac MRI has very important ways to look at coronary disease. It can use high-resolution imaging to look at presence of myocardial infarction, as well as regions of ischemia from stress perfusion imaging, all combined into one study. And there are multiple single-center studies that show that it is a very effective tool to diagnose coronary disease and also to prognosticate patients. However, the usage of this technique in the United States has been disproportionately low. So we performed the SPIN study from 13 centers in the United States to look at the downstream impact of stress CMR in studying patients with chest pain syndrome, and in terms of the prognostication using this tool, and also looking at the downstream cost effectiveness. The design of this study is a retrospective observational study from 13 US centers from 11 states. Patients were included if they presented with stable chest pain syndromes or EKG that is suspicious of myocardial ischemia. These patients were, once they identify, each of the sites will perform at least 4 years of clinical follow-up by assessing all available electronic medical records and also contacting the patients by a cardiac nurse or cardiology fellow. We standardize all the procedures of data collection with the sites by showing all the definitions of data to be collected online. And after 4 years of, after collecting the data, then we analyze the results, which was recently completed. The major findings of the SPIN study involve the results from 2,371 patients who fall into the inclusion and exclusion criteria that I just mentioned. The key findings show that those patients who have no evidence of ischemia and no evidence of infarction, which represents 68% of the whole cohort, and they have a remarkably low annual heart event rates. Heart event, I'm referring to acute myocardial infarction or cardiac death. Their heart event rate in this cohort with normal MRI was 0.6%, which is remarkably low and provide a strong sense of reassurance to clinicians who have to manage these patients. In contrast, those patients who have myocardial infarction or ischemia identify MRI, they have a substantially high event rates. They have a 3.5% chance of experiencing a heart outcome, and they have a almost 10% chance of experiencing major adverse event that included outcomes such as hospitalizations and bypass surgery during the follow-up period. The conclusion that we can learn from this data set is that in the real-world multi-center setting in the United States, cardiac MRI has a very strong differential diagnostic ability to risk categorize patients. And these informations are remarkably useful to referring clinicians in terms of making downstream decision-making, whether in terms of ordering invasive testing or providing reassurance to patients. So this information we believe is remarkably useful for clinicians to decide and also adapt the use of stress CMR in their clinical practice. Well, in terms of future study, I think this is the limitation of the SPINS cohort. Of course, it's a retrospective observational data set. I think the results provide evidence that we should conduct a large-scale clinical trial using these results to identify prospective patients and tie to the results of MRI into a strategic planning of utilizing invasive testing.